Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all work together to help prevent the spread of coronavirus. Dr. Schwartz, on Monday, we began our COVID-19 vaccine clinics, and you were one of the first clinicians at Masonicare to receive it. Can you reflect upon the significance of that moment and tell us what the schedule of vaccination is at this point?
Well, I can, Sandy, and I'm really happy to be able to tell you all this. This has been an outstanding week, an unbelievable week, and the term history was really made this week. It's just like many events, you can think about where you were when certain things happened. I know I'm going to remember probably the rest of my life where I was when these vaccines came to us. And I liken it to when I was a kid, and I actually was able to watch the men walking on the moon. It was July 21st, 1969, and I was 11 years old. Don't do the math, you'll figure out how old I am. But I remember it, Imagine being like an 11-year-old kid and you're watching the men walking on the moon. And I felt the same kind of excitement when the vaccine came on Monday. And I remember Neil Armstrong said, one small step for a man, one giant leap for mankind. And it came to me just to say one small step for a physician and one giant leap for a geriatrician. And the reason I said that, as being a doctor and over years of practicing medicine and many physicians that came before me, there were many diseases and challenges we faced: smallpox, polio, AIDS virus, and there are going to be, unfortunately, more to come. But this is one further step in our fight against disease and gives us that much more strength. The giant leap for a geriatrician meant, this is a giant leap for us in protecting our residents and giving them health, giving them freedom, giving them their life back, giving them a chance to see their families again. So it's an outstanding time in history and something that I'm very proud to be a part of. And, as far as the vaccines go, I think we had a very successful campaign. We follow CDC guidelines for vaccine administration, and we partnered with CVS, and they did an excellent job bringing equipment in and staffing clinics for us and so forth. And I think it went very, very well. And I got a little data, just basic data of what happened. And so again, there were two main sessions that we had, Monday and Tuesday, and they were there most of the day. Day one, they immunized Pond Ridge residents, Wright residents, 5 Ramage, 4 Ramage, and MHC staff, and there were about 150 staff members that got immunized. And the second day, yesterday, and I'm still waiting for some of the data of how many more staff members showed up. This is at MHC I'm talking about, but I understood it was a good turnout. So they immunized the rest of the MHC residents and MHC staff and Asher Village staff. And in January 11th and 12th, they're going to come back, and we're going to have a second series of clinics. So those of us that got the first vaccine will get the next vaccine, and others on the list will get their immunizations as well. So you can see it. Things are progressing very well. Things don't happen overnight. It's amazing how well things have, progressed. But hopefully in the next several months and by the summer, most of us, if not all of us, will have this vaccination, and life as we know it will improve for all of us. And when I do these presentations, I like to think of something that inspires me and something that motivates me. And this week's motivation, it may come as a surprise to my friend JP and our leader, but I did want to say, I read the article that he wrote, regarding who are the true persons of the year in response to Time magazine, and the frontline healthcare workers, hands down. And I got to say, I'm a frontline healthcare worker. I worked in the Sturgis 3 COVID-19 unit, and firsthand I saw the devastation that this virus can do to residents, and having to talk to families about end of life for these individuals, and it took part of my heart out and most of me out. And you know, when you go into healthcare, you don't go into healthcare for rewards. The rewards are trying to take care of people and doing what you have to do in time of crisis. But you know, to read something like this, it really meant something to me. And I want to thank you personally, because it made a big difference and really just felt special to me. And you know, I'm going to give you a special quote, which came again from our Masonic Charity Foundation calendar, which did say, "In calm waters, every ship has a good captain." Well, these are not calm waters, and I think they're probably the roughest waters I've seen in going on 26 years in Masonicare. But JP, I really want to thank you for your leadership and guidance, and for everybody, you know, being a team player, getting vaccinated and working together. So we're moving out of the rough waters and hopefully to a calm sea where we'll all have our life restored and continue to protect our frail elderly residents and give them the quality of life they all deserve. So thank you very much and happy holidays.
Just beautiful, Dr. Schwartz. And as you alluded to, JP, you decided to be amongst the first to get the vaccine when it became clear that we would have enough for all of our frontline workers and residents. Why was it so important for you to lead by example?
Well, first, Ron, thank you for the kind words. You blew me away with what you said. You know, with the vaccine coming, there was a lot of trepidation from a lot of our staff, residents, family members, people out in the community. And I spent an exorbitant amount of time doing my research to really make sure that the data tells the story, not what was being heard, but really what the data was telling us. And thanks to people like Ron Schwartz, him and I had a lot of dialogue about the vaccine. And, you know, I felt it was an obligation for myself to really lead in the front and to tell our staff and residents that this is something they should do. And it was something that was safe. I felt like I needed to be one of those first out there to do it. And I'm extremely excited that I had the opportunity to do it, because it creates hope. And, you know, when our first employee got it, Hope, I think it was just a true example of really what this vaccine brings. And for me to be one of those first ones, I wanted to be able to show everybody this is hope. This is the ability for us to get back to some normalcy. Sandy, I wanted to also tell you that, so yesterday I was up at Asher Village and I went to one of our staff members who, I will tell you, the lines were very long. They were wearing their masks, they were socially distanced and things of that nature, but they were waiting for some time. And I went to one of our staff members and I said, you know, it's going to be a little bit while. They're really working through the process. And he said to me, it has stuck with me. He says, you know, I'm doing this not only for myself, my family, but my residents. And that's what it's all about. And for them to do this, it just truly tells me the dedication and commitment of our staff. And obviously, keeping our residents safe is really everything that we're about here at Masonicare. And to have one of my staff say that, you know, just truly tells us that we have the right people working for us. And this vaccine is a step in maintaining that safety for our residents. Ron said it earlier, he was in the front lines. He was on one of our floors that he saw the devastation. That's why people like Ron, people like our staff are the persons of the year. That is really what they do each and every day is what it's all about. I would also like to make sure I say happy holidays to everybody. Continue to stay safe, continue to wear your mask, continue to do your social distancing, and avoid all large gatherings. That is not going to change for quite some time, even with the vaccine coming out.
Wonderful, JP. Just so perfectly said. Well, thank you both so much for sharing your time with us today and all of this information as always. And thank you for watching at home. We wish you a very special holiday week. Until we see you next time, stay well, stay safe.